So you have a couple things, right? We have patellar tracting dysfunction, a
Mm-hmm.
little stress underneath the patella, and then you got tendonitis underneath. So tendonitis you are icing a lot for, right? But we want to tape this to stabilize this kneecap. So whenever you bend and flex, whether you're bending down, changing levels as a dancer, or when you train, right? We want this to float and stay within its groove. But right now what happens is because you have these lateral sweep muscles, these muscles are a little bit more dominant. So what happens is when you contract this, your kneecap starts to tilt and go up this way. But we want to encourage it to go this direction first, okay? So this muscle in here, contract your quads. So this little muscle called the vastus medialis is really important. You can relax now. That contracts first. Start pulling the kneecap this way before it starts to go out to the side.
Okay.
That's actually really well developed. So, but as your foot, we see that your leg rolls out a little bit more. So we know a lot of this tension comes from your hip as well as your glutes.
Yeah.
And when they're tight and this rolls out, that causes that kneecap to tilt a little bit and start to track incorrectly. Okay. So it's really important, okay?
Yeah, for sure.
So what we're going to do is we're going to do a couple things to lift your kneecap a little bit.
Yep.
And then we're going to use some stuff to help this track better. So
Okay, awesome.
first thing we're going to do on here, I already cut these, right? So
Yep.
we cut this one, so there's a split there. And you just use the scissors and go straight up. And we use this, and when we cut these, we cut it from the back. So remember that when you do your crease, and you're going to cut it at an angle. See, there's an angle there?
Yep.
Otherwise, they'll peel up.
Yeah.
So that's why nobody cuts straight across.
Yeah, okay.
All right? So let that relax there. And so we're going to take this one first. There's a couple of different ways of doing this, but this one is going to be to lift your patella or lift your kneecap. And that's just like when you're wearing that strap, it's called a chopat strap.
Mhm.
That's to keep a little lift on there. And so that helps the cartilage underneath your kneecap.
Okay.
So the cartilage doesn't start to get irritated, wear down a little bit, or get swollen, which is where you get that little grinding sound whenever you change levels.
Uh-huh.
And so that's because the cartilage is a little bit irritated and swollen underneath. So we're going to pick your leg to be relaxed. And can you step back just a little bit? You can stay right there.
Yeah,
Just because of the light.
Yeah, it's the lighting, isn't it?
So I'm going to put a little spread on this. I'm going to go from the bottom and pull it superior upward a little bit.
Yeah.
And then I take these little tabs right here and I'll let those anchor it down.
Because the tape stretches, doesn't it?
Yeah, yeah. So it's really flexible. So you might go like 75%. Everybody does it a little bit different styles on that, but that's to help lift that.
So,
I'm going to take this piece here. Let me step back a little if you want. And because of the angle of this, we want to pull a little bit this direction to help this muscle do its job. So I took off the bottom. All you do is these just rip like that.
okay, perfect.
I peel that off, and then I'm going to stick it on your kneecap at this angle. So, can you see that angle there?
Mm-hmm.
Okay. And you already see the angle that I'm going.
Yeah.
From here, so that's my anchor there. I'm going to pull this off, so now it's on there. But you can hold it on this, otherwise it'll get bound up in your head. And I'm going to hold that and pull a little bit with the tissue,
Yes.
and then we'll just anchor that in. So what that does now is it starts to pull in this direction. So we're following that direction.
And keep the leg relaxed when I do it.
Totally relaxed, yeah. So right now we've lifted the kneecap a little bit. Now we're going to influence that kneecap to start tracking properly. Now I'm going to bend this leg to add a little bit of stretch on your quads. And this one, where I have it cut, I'm going to do that there.
Yeah.
For this one here, this one here. And to start this up further on your quadricep. This is going to help with this. I'm going to bring this straight down, and we're going to wrap around that kneecap.
Yeah.
So it holds it, stabilizes it a little bit.
Good.
So I'm going to start up high.
Mm-hmm.
And I'm glad you shaved.
Shave the legs.
Well, you don't have a lot of hair to begin with, but it just
Yeah.
makes this stick a lot better.
Absolutely.
Okay? Yeah. Otherwise, especially on really hairy legs, it doesn't stick so well.
No, yeah.
So
It
I
needs
pull
to
that
be-
off.
it needs
Now
to
I'm
be-
holding these two tabs. You
Okay.
can see there. And from here, I'm going to pull a little stretch there. And get just to the edge. And then from here, can you come a little closer on this side? I'm going to wrap this around and push that in. And then on this side, we wrap it around. See how we just follow it there. You'll be able to see this when you,
Yeah,
when you look.
definitely.
So see, now the patella's in the center there. So I put that stretch on the muscle. So I didn't have to put as much stretch on the tape.
Yeah.
So now when you straighten it, it pulls a little bit. So we wrap it around
Uh-huh.
like that.
Awesome.
So that helps a lot with that kind of stabilization and also patellar tracking. So on top of that, as you know, throw that away. It's so important that you start to work the TFL over here. Can you
Yeah.
step on that end a little bit? Yeah. So I'm going to use this thumb right here. And if we're on that side, it's the tensor fasciae, but I'm going to pull and press because we're going to open that up and I need you to breathe because I know it's uncomfortable.
Mm-hmm.
I'm going to bend this a little more.
Yeah.
There we go. So,
Oh yeah, it's so much fun, but it feels really kind of annoying but good at the same time.
our camera person's good. She moves around a lot. So again, I'm pulling, and as I'm pressing, I'm breaking those fibers, causing a little cross friction.
Okay.
I know it's uncomfortable, but you gotta get this. 5, 4, 3, 2, one more, 1. And can you come over the top of that just a little bit? So you can see where this is at. That's okay. So we're coming right in here. And as I pull the leg, I'm pressing this direction. Pull and press. Good. And I know it's super uncomfortable. Awesome.
Feels so good though.
And then, super good. And as we bring this up, because your IT band, that's part of your IT band. So you use your foam roller,
Yes.
your Theraguns, all those things everybody's using, or good old fashioned palms.
Yeah. And it's always good to come see you when you've done legs the day before. It's always
yeah.
awesome. Love that timing, don't you, Dr.
Yeah,
Greg?
yeah. Makes you feel better, right?
Yep. Yeah, foam rolling like every day, right?
Yeah, so we just want to really open these so there's no adhesions, especially because the way you train so hard.
Yeah.
And dance is just no joke, you know?
Yeah.
So,
I was thinking of
glutes
getting like a
tight.
scraper too, maybe.
Yeah, you
Would
can. So
recommend
the
it?
Graston type
Would
scraper.
you, yeah, would
Uh-huh.
you recommend that too?
Those are great. Yeah, yeah.
Okay,
You
cool.
should learn how to use that
Yeah,
properly.
because you don't wanna like overdo it,
Right. Yeah. And I'm going to get in here a little bit, okay? And again, it's just another angle to get this IT band here. So as I bring his leg up, I'm using my elbow to strip. And although on there it probably doesn't look too hard, on here it's no joke. Yeah.
He's way stronger than he looks.
Not sure if that's a compliment.
It is a compliment.
Better to be sneaky.
Oh, he's literally
Better to be sneaky.
If you're watching this, if this goes on Instagram, he's literally kidding me. It just doesn't look like it, and he's not even trying.
So now we're gonna do one more thing for psoas muscle in here.
Oh, I love
Because
this. I love this
psoas-
one. I'm a big fan of
Yeah.
this too.
When that's tight, it causes external rotation of the leg as well, and that'll also affect this knee. So we want to hit all these different areas, grabbing the muscle and then stripping it down. So we grab it and strip, grab it and strip. Not comfortable, but super effective.
Mhm.
Yeah, keep breathing, brother. One more. Good. Awesome. We'll go this side, just keep it balanced on this.
Can you feel a difference in each side or not?
Yeah, this side's actually tighter than the other side right now.
Really?
Yeah, and I think you might be doing a little compensation because your knee is feeling a little unstable on the left. So you're putting more weight on
Definitely.
this right side.
Yeah, I can feel that.
Yeah.
Whoa.
Yeah.
It's like it doesn't. Oh yeah.
Yeah. Juana, thank you.
Yeah.
Appreciate it.